Hello, dear nursing officers and nursing aspirants. Welcome you all to the Master Nursing classes. As all of you know that we are discussing the very important topics for our upcoming RRB Nursing Superintendent exam. So already we have completed the part 4 video successfully. In that particular video session, I have discussed the all possible questions with clarity of the concept that will comes in your upcoming RRB exam. And today we are here to discuss the part 5 of the Nursing Superintendent exam. This is the 2019 question paper of the RRB. The kind of the question, the pattern of the question, okay, the level of the question paper. So each and everything I will discuss with a perfect questions with a clear concept and the concept that will makes you easy for the getting marks here. Okay, so well, once again welcoming you all to the master nursing classes. Okay, so we will start the class with one beautiful motivation quote here. Students, believe in yourself. If you believe that the goal is yours, the aim is yours, the action is yours, and the direction is yours, believe that first. So if you are believing in a particular thing, means you are halfway there already. Okay, so don't be in the negative thoughts. Okay, don't listen the negative facts, don't listen the negative news. So be in the positive vibes. Okay, so be connected with the master nursing classes that always gives you a positive vibes. Okay, so without wasting the time, we will start the today's class, students. Here, okay, so here is the first question in front of you all. Read the question carefully, completely, and try to give the perfect answer for this question. Okay, so I will discuss a very important question on this one. Okay, so let's read the question first carefully, then try to give the best answer for this question. Okay, yes, the question is very simple. What information the nurse should consider while collecting the history of a child with suspected rheumatic fever? Okay, the child came to the hospital and the nurse is suspecting that the child may have the rheumatic fever. So which of the following history that supports the diagnosis of the rheumatic fever here, students? So option A tells that yes, a fever that started 2 days ago. Option B tells the vomiting of for 2 days. The child is vomiting since from 2 days. Option C tells that a lack of interest in the food. Okay. Option D is here a recent episode of the pharyngitis. I am waiting for your answers here. Yes. Who all are know the answer? Please do comment in the comment box first. We will move forward to the answer explanation. Yes. Very good. Very nice, students. Yes. This is what I want from you all. Yes. Option D, who are giving the correct answer. Yes. The recent episode of pharyngitis that supports the diagnosis of the our yes suspected rheumatic fever. My question is how and why. So this concept you should in your mind. Okay, and what are the other history can comes in your question format. Okay, so yes, in the instead of the pharyngitis, the examiner may give the sore throat, a history of the sore throat. Okay, or else he can give the yes the history of the dental procedures without prophylactic antibiotic. Dental procedures means any root canalization. Okay, any periodontitis treatment, any tooth detection, that kind of the history he can give. Okay, yes, so dental procedures without the antibiotic prophylaxis. Okay, so these histories, and in some cases yes the untreated skin infection. Infection with what? Yes, infection with which organism? Yes, that is the group A beta hemolytic streptococcus. This particular causative organism is responsible for the our rheumatic fever. Okay, the child may have the sore throat because of the group A beta hemolytic streptococcus. Okay, if dental procedures the dentist done without giving the prophylaxis antibiotics, that is chance of entry of the microorganism into the heart, and that may leads to the rheumatic heart disease. Okay, so the dental procedure history also will comes in the rheumatic heart disease. And skin infection, that is I told the one word, that is untreated skin infection of the beta A group group A beta hemolytic streptococcus. Okay, so this will as a causative organism of the rheumatic fever. Okay, always remember the examiner may give the yes history of the sore throat or the pharyngitis, dental procedures without prophylactic antibiotic, and untreated skin ulcers. Okay, with the group A beta hemolytic streptococcus, that is the yes history that's supposed to the diagnosis of the our beautiful yes rheumatic fever here. Okay, so hope the concept is clear here. Yes, yes. And for the rheumatic heart disease, we have the criteria of the, yes, modified Johnson's criteria. We will discuss in the cardiology in detail. Okay, so here is the next question. Yes, very simple question. Yes, read the question carefully. I am watching for your comments. Do comment it fast. The storage form of the carbohydrates in animals. Remember, human is also an animal. Okay, a man is also, or a woman is also, or you can say the human is also an animal. Okay, so in animals, what is the storage form of the carbohydrates? Yes, very nice, students. All of you have given the particularly answer. That is correct. That is the glycogen. So my next question is, yes, where glycogen stores? Option A, in the spleen, option B, in the pancreas, option C, in the liver, and option D, in the, yes, intestine, where it will store. Yes, very nice, students. The glycogen, it is the storage form of the carbohydrate. It will store in the liver. Okay, so liver can store glycogen, liver can store vitamin A, liver can store iron, liver can store copper. Okay, so very importantly, students, liver can act as a storage organ for these all: iron, copper, glycogen. Okay, yes, okay, done. Okay, so the storage form of the carbohydrates in animal is the glycogen. Hope the concept is clear here. Yes, so what is the starch? Starch is the, yes, it's in carbohydrate which is in the compound form. Okay, so not a simple form of the carbohydrate. Starch is a compound form of the carbohydrates. Students, when you will study the carbohydrates, we will study the monosaccharides, disaccharides, like this. So these all are the disaccharides. I will explain what is monosaccharide, saccharide, and what is disaccharide. Okay, these all are the monosaccharides. These all are the monosaccharides. These all are the disaccharides. Why I said these all are di? Okay, why I said these all are di and these all are mono? Mono stands here as a single and di stands here as a double. Means, yes, the composition of the glucose plus fructose which forms the sucrose. Means this is one. It forms as a combination of one. That is the combination of the two, that is the one. So we call this one as a monosaccharides, and these all are the disaccharides. Students, in the exams many times from the nutrition topic, they have asked the question that sucrose is made up of. Sucrose is made up of glucose plus fructose. Okay, of the concept is clear. Then what about the lactose? Lactose is made of the, yes, the glucose plus galactose. Okay, remember, lactose is made of the glucose plus galactose. Okay, ग्लूकोज के साथ लैक्टोज मिलके ग्लूकोज बनाते हैं. ओके, सो व्हाट इज मेड ऑफ माल्टोज? माल्टोज इज, यस, ಗ್ಲೂಕೋಸ್ ಮತ್ತು ಗ್ಲೂಕೋಸ್ ಕಲ್ತು ಬಿಟ್ಟು ಮಾಲ್ಟೋಸ್ ಫಾರ್ಮೇಶನ್ ಆಗುತ್ತೆ. ವಾಟ್ ಇಸ್ ಮಾಲ್ಟೋಸ್? ಮಾಲ್ಟೋಸ್ ಇಸ್ ಅ ಕಾಂಬಿನೇಷನ್ ಆಫ್ ದಿ ಗ್ಲೂಕೋಸ್ ಪ್ಲಸ್ ಗ್ಲೂಕೋಸ್. ಓಕೆ, ಸೊ yes, it will helps you all. Remember this one: glucose plus glucose is maltose, glucose plus galactose is lactose, glucose plus fructose is lactose. Okay, focus here how to remember. In all the monosaccharides, okay, glucose is common. Here is the glucose is common, here also glucose is common, and here is also glucose is common. So it will makes me, yes, to remember easy. Okay, so glucose is common here. So how can I remember this one? You can remember, students, glucose plus lactose, it forms the lactose. Okay, one is clear. Okay, so yes, sucrose, you can remember this one as a sugar. Sugar is made up of the fructose. Okay, very simple. Yes, yes. Then maltose is the glucose plus again glucose, that is the maltose. Okay, so man is always sweet. Okay, so remember this: man is always over sweet, means glucose plus glucose. Okay, he is over sweet, that is the maltose. We can remember M as a man and over sweet. Okay, that is the glucose plus glucose, maltose. Hope the concept is clear. Yes, yes, it's very nice. My question, next question is on this one. So which monosaccharide that gives, yes, energy to sperm? Okay, which monosaccharide among the given option, yes, that gives energy to the sperm? Okay, so remember, students, the monosaccharide, yes, that gives energy to the sperm, that is very easy. That is our fructose. Remember, one liner question that may comes in your exam. Okay, yes, the fructose is the monosaccharide that gives energy to the sperm. Okay, that gives energy to the sperm. One concept, one question is clear. Okay, so my next question is, in breast milk of the mother, okay, in breast milk of the mother, which carbohydrate is abundant? Yes, can anyone tell? Yes, that is the lactose disaccharide form. Okay, lactose is the carbohydrate which is abundant in the breast milk. Okay, yes, breast milk of the mother, it is abundant. So did you heard? Yes, the breast milk is rich in lactalbumin. Okay, lactalbumin. So here is the albumin is protein, lact is, yes, carbohydrate. So protein, albumin and carbohydrate, lactose, this is the, yes, the abundant in the breast milk. Okay, so breast milk also containing the easily digestible protein, that is we also called as the whey protein. So that we will discuss while discussing the, yes, the breastfeeding topic. Okay, so is that clear? Clear. Okay, remember these two important points: the lactose which is abundant in the breast milk, okay, and the fructose which gives the, yes, energy to the sperm. Okay, sperm motility energy will given by the our fructose carbohydrate. Is that clear? Yes, yes, very nice of you all. Okay, yes, here's the our option. Yes, we have discussed the 46 question here that may helps you all for your examination. Okay, yes, make a note of all the thing what I am telling here. Okay, so that this kind of the explanation will never get in your questions. Okay, so here is the next question. Let's read the question carefully, then give the correct answer for this question. Okay, I am waiting for your answer in the comment box. Yes, the very simple question that all of you can answer easily: an accumulation of the blood in the intrapleural space, in the intrapleural space, that is what we call, yes, option A chylothorax, option B tungsten pneumothorax, option C pneumothorax, option D that is hemothorax. Yes, can anyone answer? Let me clear what is pleura and the questions related to pleura, then I will come to this answer. Okay, so what is intrapleural space we have to know. Yes, very simple. Students, consider this one our beautiful lung. Okay, this is the trachea, bronchi. Okay, the right lung that is containing of the three lobes, you know, this containing of the three lobes, and as the left lung, this is containing of the only two lobes. Yes, is this clear? Yes, so the right lobe containing the three lobes, left lung containing the two lobes. Okay, and right lung have the two fissures. What is the fissure? Fissure is the, yes, the line which dividing the lobes of the lungs, that is the fissure. Right side lungs is having the two fissures, look at this one. Yes, and left side lung is having the only one fissure, this one. Okay, yes, so a right lung contains three lobe, left lung contains two lobe, a right lung contains two fissures, left lung contains two fissures. Okay, sorry, left lung contains only one fissure. Is that clear? Clear. So on the lungs, okay, so we are having the covering that is called as pleura. Okay, pleura, this green layer which is near to, yes, a lung, that is what we call as the visceral pleura. Okay, so one more layer which covers the lungs, that is the red color one, so we call this one as in the, yes, the parietal pleura. We call this one as in the parietal pleura. Okay, so this one is the parietal pleura, and inside this one, yes, again what I told, the pleural cavity which is attached to the lung, that is the visceral pleura. So what viscera stands? Viscera stands as a, yes, organ. Okay, the pleura which is attached to the organ, that is the visceral pleura, and outer side pleura, that is the our parietal pleura. Okay, so in between this pleural space there is in between these two pleura there is space, this space. Okay, this space we call as in the pleural space. What we call this one? The pleural space. So in this particular pleural space, if air accumulated means, that is what we call as in the pneumothorax. What we call that one as in the pneumothorax. If air accumulating and it is going back also, that one as the simple pneumothorax. And if air accumulating and it doesn't having the space to escape back, means the air is coming, and it entering the pleural space because of this some rupture in the lungs, and it is unable to escape back. So that is what we call as in the tension pneumothorax. That is what we call as in the tension pneumothorax. Yes. And if in case in this pleural cavity, if accumulation of the blood is there, means we call that was in the that is very simple, hemothorax. What is blood? Blood is the hemo. In which area it is accumulating? It is accumulating in the the covering space, that is the parietal visceral space of pleural space of the lungs. So we call this one as in the hemothorax. What it if it accumulation of the lymphatic fluid in this pleural cavity? If accumulation of the lymphatic fluid, if accumulation of the lymphatic fluid in this pleural cavity, we call this one as in the chylothorax. We call this one as in the chylothorax. Hope the concept is clear. Yes. Can I ask question for you? Yes. Very simple. Which flora which lying directly on the lungs? Answer fadafat. Which flora which lyingly directly over the lungs? Is this a visceral pleura or parietal pleura? V flora. Okay. In short form, it is the visceral pleura. Correct answer. Okay. So what is the pleural space? Pleural space is a space between the visceral pleura and parietal pleura, which covers the lung. Okay. Is this clear? Clear. Yes. Then my question is, I will give the definition. You tell the I am for which word I am giving the definition. Accumulation of the lymphatic fluid in the pleural space. Accumulation of the comment fox students. Comment fox. Accumulation of the lymphatic fluid in the pleural space. That one we call chylothorax. Perfect answer, students. Then accumulation of the blood in the pleural space. That is the hemothorax. Perfect answer. Then next question is accumulation of the air in the pleural space. That is pneumothorax. Perfect. And accumulation of the air in the pleural space and it is unable to escape back. That is what we call as the tension pneumothorax. Perfect answer, students. So hope the concept is clear for this one. And now give the answer for this question is the accumulation of the blood in the internal pleural space is known as comment the option A, B, C, D. Which one? Fadafat. Very nice, students. That is the option D. That is the hemothorax. Hemothorax is the accumulation of the blood in the intrapleural space. Okay. So what if it is accumulating? So we have to remove this one. That is what we call as on the thoracic tapping or thoracentesis. Okay. What we call this one is the removing of the blood, removing of the fluid, removing of the pus from this cavity. So that is what we call as on the thoracentesis. Okay. So thoracentesis is two type. That is, one is for the diagnostic purpose, another one is for the therapeutic purpose. If there is over accumulation of the fluid, we have to remove the fluid in order to relieve the compression from the lungs. Okay. So that is the therapeutic one. So for the testing purpose, so which kind of the cells are present, okay, whether it is because of the TBA, whether it is because of the lung cancer, so we have to identify the cause. So that is what we have taking the fluid from the pleural space. That is called as the diagnostic thoracic tapping. Okay. If you are taking the fluid for the purpose of the relieving the pressure from the lung, that is what we call as in the therapeutic pleural tapping. Okay. Or therapeutic, what we call thoracentesis. Okay. So is that clear? Very nice of you all. Okay. Here is the next question. Read the question clearly, then give the answer for the question. It's very important, students. In each and every question I am discussing all possibles easy questions with easy concept. Okay. So we will discuss in detail when we will study the system. Okay. After the completion of this whole question paper discussion, okay, I will come for the very important 120 topics for your upcoming RRB exam. I am definitely assured that the question will comes directly from that particular concept what I will teach for you all. Okay. So so here is the next question. Few of you have given the answer. Your concentration level is next. Okay. Here is the question. The arterial blood gas ABG analysis report shows that decreased bicarbonate level and pH value. What it denotes? Bicarbonate also decreased and bicarbonate value also decreased and our pH also decreased. So what we call this one? Yes, students. Very nice of you all. Yes, you are all of you have given the correct answer. That is the yes, decrease in the pH. That is called as the acidosis. Yes, that is the acidosis. I am eliminating the two options here. That is the alkalosis, alkalosis. Okay. So here is the decrease in the bicarbonate also, means it is related to the metabolic. So this is the metabolic alkalosis. Yes, very easy question. They have asked related to the ABC analysis in the yes 2019 paper. So here is the some basic values. So that helps you all for the immediately predicting the yes ABC report. Okay. So students, yes, first we have to know the what is normal values. Then we will go for the yes interpretation of the ABC. Okay, my question is the what is normal partial pressure of the carbon dioxide? Can anyone tell what is normal partial pressure of the carbon dioxide? Yes, already I have discussed this one in the part 1 video. Yes, very nice of you all. That is the 35 to 45. What 35 to 45 kilometer? Yes, you have to tell the complete answer, students. 35 to 45. Yes, what I have asked? Partial pressure of the carbon dioxide. So pressure will be monitored in the of Hg. Yes, clear? Yes. Then what is the partial pressure of the oxygen? What is the partial pressure of the oxygen? Yes, in the blood. Can anyone tell? Yes, very nice of you all. That is the 80 to 100 of Hg. Then my next question is, can anyone tell? Yes, what is the normal pH of the blood? Normal pH of the blood. Yes, can anyone tell? Yes, 7.35 to 7.45. Okay, done. Then what is the normal bicarbonate level? What is the normal bicarbonate level? Yes, very nice of you all. That is the 21 to 27. Yes, milli equivalent per liter. Okay, is this clear? Clear all of you? This is the normal value. Many time students, many time the question will comes from the normal value only. Okay, so remember the partial pressure of the carbon dioxide is the 35 to 45. How you can remember? The pH is the 7.35 to 7.45. Okay, get the 35 from here, keep it here. Okay, get the 45 from here, keep it here. Okay, so this is the how you have to yes correlate and study. Okay, yes, clear? Yes, the PaCO2 is the 35 to 45 mmHg. Okay, and normal pH is the 7.35 to 7.45. So bring this 35, keep it here. Bring this 45, keep it here. Okay, so one value you remember, that is the normal pH of the blood. So another value will comes to in your mind. Okay, so this is very important to remember the PaCO2 also. That is the 80 to 100 mmHg. Okay, and bicarbonate level is 21 to yes 27 milliequivalent per liter. So now I will teach you a single step that will helps you to predict the what is the ABC analysis answers. Okay, so yes, if pH and bicarbonate, that is the HCO3, both in same direction, means this is the yes a problem related to the metabolic, not respiratory. Okay, so if the pH and bicarbonate both decreased, means yes pH is decreasing, means that is the acidosis, and bicarbonate decreased means that I have told it is the problem related to the metabolic. Okay, so we can say this one as the metabolic yes acidosis. Yes, if the pH and bicarbonate increasing, means yes pH is increasing, means what it stands here, pH increasing means that is the yes alkalosis, and it is bicarbonate also altering along with this one. So this is the yes metabolic alkalosis, and this is what I tricks I am telling you, students. Actual stories are different. I will teach in detail when I was teaching the ABC. Okay, so again here this come this side. Okay, so write pH, and here this side we have discussed the metabolic acidosis, alkalosis. What is remaining? Yes, respiratory acidosis, alkalosis. What is the important thing that is helpful for the diagnosis whether it is in respiratory? That is the PaCO2. Okay, students, if pH decreases, PaCO2 increases. Okay, pH decreases, PaCO2 increases. Students, here the pH is decreasing and PaCO2 is increasing, means pH is decreasing means that what it stand here, that is the acidosis. Okay, and PaCO2 increasing means what it stand here, that is the problem related to the respiration. Okay, problem related to the respiration. And yes, this is pH decreasing means that is the acidosis. So now the answer is respiratory acidosis. Okay, yes, again come here. Okay, pH and PaCO2. Okay, so pH is increasing and PaCO2 decreasing. Okay, pH is increasing, PaCO2 decreasing. Okay, so students, pH is increasing means what it stands? Yes, it is a pH increasing means that is the alkalosis, and PaCO2 decreasing means again problem related to the respiratory. So respiratory alkalosis. You can easily identify the answer based on the direction of the our pH value and PaCO2 value and bicarbonate value. Hope it is clear. Okay, in metabolic it is same direction. Okay, in respiratory it is opposite direction. Okay, hope the concept is clear. Okay, so now I will give an example for you all. Yes, try to solve that example. Okay, so I will ask the question. Yes, in a patient of the COPD, when we will assess the ABG analysis of the patient, we found that PaCO2 of the patient is 60 mm of Hg and pH of the patient is, yes, pH of the patient is, that is 6. Okay, so pH is 6 and PaCO2 is 60. So now what happened here? Okay, I told patient is having the history of the COPD, that is chronic obstructive pulmonary disease. Okay, just try to give the answer for this one. I'm waiting for your answer. Yes, pH, what happened here, students? What is the normal pH? I told 7.35 to 7.45. So this is less than the normal. So we can say pH is in negative direction. That is the, yes, acidosis. Okay, acidosis. Okay, and here the PaCO2 is, yes, 60 mm of Hg. So this is increased. Okay, so what I told, in the respiratory conditions, both in opposite direction. Yes, pH is 6 means it is decreasing, and PaCO2 is 60 means normal PaCO2, that is 35 to 45. Here it is the, yes, more than 45. So PaCO2 increased. That is what we call as in the, yes, respiratory problem. Okay, so altogether answer it will come as the respiratory acidosis. Clear, students? Hope the concept is clear for this one. Okay, yes, very nice of you all. So your involvement is very active today. Yes, hope the concept is clear for this question. Where is the question? Just a second. Yes, is that clear? In the respiratory acidosis, what happens? Respiratory alkalosis, metabolic alkalosis, each and everything I have discussed here. Okay, so and you have to consider the history also given in the question. Like if we want to ask the question like related to the metabolic acidosis, he will give the history of the like diabetic ketoacidosis. Patient is having the diabetic ketoacidosis, or patient is having the aspirin toxicity. Okay, aspirin toxicity, like he will give. What happens in the aspirin toxicity? Yes, aspirin, what is the name of the chemical name of the aspirin? That is acetyl salicylic acid. So yes, is that clear? Yes, and also he will give the diarrhea also. In history, he will give the diarrhea also. Okay, chronic diarrhea, aspirin toxicity, yes, diabetic ketoacidosis. So in this condition, metabolic acidosis will happen. Okay, and in respiratory acidosis, he will give the history of the like COPD and other lung diseases. Okay, and in respiratory alkalosis, he will give the history of the hyperventilation. That is the hyperventilation condition. Okay, and in metabolic alkalosis, he will give the history of the chronic vomiting. In vomiting, yes, what is there in the stomach content? That is the HCl, hydrochloride. Okay, so this acid is the very dangerous acid. This acid will get lost means yes, pH will get increases. Okay, so because of the loss of the acid content, so again chronic vomiting, or also he can ask the questions like patient, we are having the intermittent suctioning of the gastric content. Okay, continuous suctioning of the gastric contents, what may be the metabolic value changes it will happen? That is the metabolic alkalosis, because in the continuous or intermittent suctioning also, yes, we are removing the gastric content. Yes, we are removing the gastric content means we are removing the HCl. We are removing the HCl means we are removing the acid. We are removing the acid means yes, the pH will increases, it may leads to the metabolic alkalosis. Okay, hope the concept is clear. Okay, all possible questions that may ask in all directions related to the ABG, we have tried to discuss here. Okay, yes, here's the next question, and very easy question for you all. Yes, that is the isotope of the cobalt. Isotope of the cobalt is used in the treatment of which of the following disease? Yes, I am waiting for your answer. Option A, anemia. Option B, cancer. Option C, goiter. Option D, that is the AIDS. Students, remember, in the treatment of the anemia, we have the three options. If the hemoglobin is from 10 to 11, we will go for the oral iron supplementation. Okay, so that is the oral iron supplementation. Okay, yes, it is. If it is 7 to 9, so we will go for the parenteral iron supplementation, that is the injection iron sucrose. Okay, or we can say injection FCM, that is the ferrous carboxy maltase. Okay, so these are the parenteral iron supplementation. Okay, so students, how we will give the injection iron sucrose? We can give IV also. Okay, mostly. And yes, one technique we will use to administer iron sucrose, that is the intramuscular. Which technique? Repeatedly asked question. Yes, that is the Z track technique we will use to administer intramuscular iron. Okay, hope the concept is clear. Okay, so and in the if the HB is less than 7, so we will go for the blood transfusion. Okay, so this is the treatment options we have for the treatment of the anemia. Okay, so cobalt is not having any roles in the treatment of the anemia, so answer is not anemia. Okay, so is this clear? Yes. So then I will come to the next option B, that is the cancer. So in the cancer, we are having the treatments option, students, that is the radiation therapy and chemotherapy. Yes, in the radiation therapy, we are having the teletherapy and brachytherapy. Teletherapy and brachytherapy. Okay, we are giving the external radiation, that is the teletherapy, and we are giving the radioisotope implantation in the particular cancer area, that is the internal radiation, that is the brachytherapy. Okay, that is the brachytherapy. Okay, so in chemotherapy, we are having the like cell specific drug, cell non-specific drug. Okay, there are lots of the chemotherapeutic drugs are there. We will discuss that one while discussing the pharmacology. Okay, clear? Yes. So this is also not an answer. So yes, specifically cobalt is used in the treatment of the our beautiful disease, that is goiter. Okay, so that is goiter. Goiter occurs due to the deficiency of the iodine. Okay, so iodine deficiency which may leads to the goiter. Iodine deficiency in the agutade. Okay, so one general questions will comes in exams. What is the goiter belt of the India? What is the goiter belt of India? Means in one particular geographical area, of our particular country, that is India. So in India, in one particular area, the goiter cases will seen are lots and lots because of they have very less iodine in their food. Okay, so now I want you all to write what is the goiter belt of the India in the comment box. Okay, yes, what is the goiter belt of the India? You have to write in the comment box. This is the assignment from my side to you all. Okay, so this is the answer for this question. Now for the treatment of the AIDS, what is the answer option we are having? So we are having the antiretroviral therapy. Okay, so previously on antiretroviral therapy, we have to give the drugs like separately. In ART, we will used to give the drugs separately. That is the lamivudine. Okay, and tenofovir and efavirenz. Okay, so now in the heart, that is the highly active antiretroviral therapy. This is the new model of the treatment we are using for the HIV. In this one, we are having the fixed dose combination. Means the lamivudine and tenofovir plus one new drug, that is the dolutegravir. Okay, dolutegravir. Okay, so these drugs all together combinationally will give in the FDC, that is the fixed dose combination. Okay, so the question will ask which drug which recently added in the treatment of the HIV, that is the dolutegravir. Okay, so that is the dolutegravir. Okay, lamivudine and tenofovir is the oldest drug we are having. So in the heart, that is the highly active, yes, antiretroviral therapy, we are giving the fixed dose combination. Previously we used to give the, yes, separately doses. Okay, is that clear? Yes. And answer for this question will be the option C, that is the goiter. Yes. So what are the question we have discussed in question? To take we will quickly revise that one. Okay, what is the treatment option we have if the hemoglobin of the patient is from the, yes, 10 to 11? Option A, oral iron supplementation. Option B, Z track intramuscular iron. Option C, yes, blood transfusion. Come on, fast. Yes, very nice of you all. If the human being having the hemoglobin of the, yes, 10 to 11, we will consider that one as in the mild anemia. In that particular cases, we will give the oral iron supplementation. Is that clear? Then come to the next question what we have discussed. Yes, that is if the hemoglobin level is from 7 to 9. Okay, so that one we called as the mild anemia. In that cases, we are having the, yes, parenteral iron supplementation, that is injection FCM, that is the injection ferroxy carbox maltase. Okay, FCM, and we are having the injection iron sucrose. Okay, so if the mild anemia is there, we will give the iron sucrose plus injection FCM. Okay, so this one, the style of the administration or the method of the administration of the injection iron sucrose that they have asked many times in the exam, that is the intramuscular Z-TAC technique also we can administer, or after giving the test dose, if the patient found non-reactive or not having any allergy, we will give the, yes, IV supplementation of the iron sucrose also by adding the, yes, 10 ml of the iron sucrose in the 500 ml of the normal saline. Is that clear? Yes, clear. Okay, then when we will administer the blood transfusion to the patient of the anemia. Okay, what is the criteria according to WHO? What is the criteria to administer the blood transfusion to the patient of the anemia? Yes, if the hemoglobin level is less than 7, so we can administer the blood transfusion to the patient of the anemia. Hope the concept is clear. In the cancer, second option, that is the cancer we have discussed. Yes, two model of the treatment, that is the chemotherapy, radiation therapy. Yes, what is the radiation therapy? We are giving the externally. What we call, if the radiation therapy we are giving externally? Yes, can anyone tell? Yes, that is the very nice of you all. If you are giving the radiation therapy externally, that is the teletherapy. Okay, so then what is the radiation therapy we are giving, or radioisotope we are giving in directly keeping in the, yes, the area of the cancer? Okay, that is the internal radiation therapy, is also known as, yes, can anyone answer? Very nice of you all. That is the brachytherapy. What is the internal radiation administration method? That is the brachytherapy. Okay, yes, nice of you all. Okay, in the goiter we are having the, yes, isotope of the cobalt we will use for the treatment of the goiter. Okay, in the AIDS we have discussed the antiretroviral therapy, and we have seen the heart full form also, that is the highly active antiretroviral therapy is the current model of the treatment for the HIV. Is that clear for this question? We have discussed the more than 10 to 15 question on this question. Yes, yes, here is the next question for you all, and very easy question for you all. Let's read the question completely, then give the best answer for this question. Which cell or takes part in the innate immunity by killing the virus infected by cells? Yes. So which cells are the cells which are responsible, yes, or which takes part in innate immunity by killing the virus infected cells? Okay. So yes, which cells helps to kill the virus infected cells? Students, there is a word. Okay, listen, there is the innate immunity as well. Okay, so whenever the innate immunity words comes, the answer will goes to the, that is the natural killer cell. Okay, natural killer cell is the cell we are having in our body that kills the virus infected cells in our body. Hope the concept is clear. Yes. Next, here is the next cell, next question. Yes, very simple question, and the question on the research topic. Okay, so we'll discuss this one. Okay, definitely it will come in your NORCET prelims and in your RB exam as well. Okay, the relationship between the two or more variables is called, the very repeatedly asked question. Okay, very simple question. I think all of you will give the correct answer for this one. Okay, yes, that is the very nice of you all. Yes, that is the hypothesis is the correct answer, students. The relationship between the two or more variables, we call that one as in the hypothesis. Okay, so we can say the predicted relationship between the two or more variables, like for example the relationship between the smoker and lung cancer. Yes, smoker and lung cancer. So we can say chronic smoking may leads to the lung cancer here. Okay, so we are predicting the relationship between the two variables. Okay, variables are the a thing that may changes its value, that is called as the variables. In the variables we are having the two variables, that is independent variable and dependent variable. Okay, so here in this given example, which is the independent variable? Okay, so in this one, which is the independent variable? In this one, yes, which one is manipulatable, which one is the changeable, that is what we call as the independent variable. Okay, so and which one is the dependent variable, which comes as a result of the independent variable. Okay, here's a lung cancer come as a result of the independent variable, so that is what we call as the dependent variable, students. Okay, for example, less intake of the iron, which leads to the anemia in the patient. Okay, now tell me what is the, yes, dependent variable. What is the dependent variable, students? In the given example, I am asking that, yes, less intake of the iron, which leads to the, yes, iron deficiency anemia. Okay, so now tell me what is the dependent variable. Is that a clear question for you all? Yes, very good of you. Yes, that is the iron deficiency is the independent variable. Okay, sorry, intake of the less iron is the, that is our independent variable, and anemia which is coming because of the less intake of the iron, the anemia is the dependent variable. Hope this clear. Okay, this kind of the questions the examiner may ask in the questions on the variables and the hypothesis. Hope the concept is clear. So now come to the question, that is the error. Okay, so error, they will ask in the questions on the error. Okay, so error we are having the, yes, two types of the error, students. That is the, yes, the type 1 error and type 2 error. So for type 1 error, we also called as in the alpha error. Okay, and for type 2 error, we also called as in the beta error. Okay, so now tell me what is alpha error, what is beta error. So I will tell the definition. You have to tell which one is this. Yes, the researcher is rejecting the hypothesis which is actually true. Means the true hypothesis will be rejected by the, yes, researcher because of the lack of evidences. So we are telling something, the relationship is there between these two variables. Okay, so that is actually true in nature, but we don't have the evidences to prove that one. So yes, that's what my hypothesis is rejecting. Okay, so the hypothesis which is actually true and which is rejected, that is what we call as the type 1 error. Okay, so the true hypothesis is rejected because of the lack of evidences, that is type 1 error or the alpha error. And if the researcher is unable to reject the hypothesis which is actually false, okay, so the hypothesis, the predicted relationship between two variables is which is actually false, but he is unable to, yes, reject that one. So means failure to reject the false hypothesis or the failure to reject the hypothesis which is actually not true, that is what we call as the type 2 error or beta error. Okay, hope the concept is clear. Yes, so the answer is clear for this one. So the definition of the research is very simple here. Research, search again and search again in the view of the, yes, improving the knowledge of the profession, in the view of the giving the evidence for the practices. So you have to search again. So that is what here the research definition stands here. So the correlation is the statistical topic. It takes a lot of time to discuss, students. So we will discuss in the another class this one. Okay, so hope the concept is clear for this one, and the answer for this question is the predicted relation between the two variables, that is the hypothesis, is your correct answer. Hope it clear. Yes, yes. Here's the next question, students. Very simple questions. Okay, all of you can give the correct answer for this one. Yes. What percentage does burns of the genitalia constitutes by rule of 9? Okay, according to rule of 9, so burn area in the genitalia, only in the genitalia, how much percentage it constitutes? Yes, option A 21, option C 18, option B 1, and option D is the 9. Very, very nice of you all, students. Yes, it's the option B, that is the 1% of the body surface area will consider its burn if it's only burn area to the genitalia. Okay, so next my question is yes, the patient is get burned with the his head and neck. Okay, head and neck is burned plus his right arm. Okay, his right arm. So now what is the how much percentage of the body surface is get burned here according to rule of 9? Yes, can anyone tell? 9, 18. Okay, so yes, which one is the correct answer? Can anyone tell the final answer? Yes, it's 18 students. Okay, whenever there is a burns to the head and neck in the adults, we consider it as the 9%. If the exam is not given, it is adult or the child, consider always it is in the adult only. Okay, so if head plus neck is get burned, okay, so that one we consider as a 9% adult, and the right arm, one arm is considered the 9%. Okay, so yes, one more arm we consider this one as in the 9%. So 9% plus 9% here as the 18% of the body surface area is get burned here. Okay, so yes, is that clear how we will identify? This is the actually we will consider. Okay, so for head, okay, 9%, and for anterior chest 9%, and posterior chest. Okay, let me change the pen color here so you can see it very easily. Okay, so yes, head and neck it's a 9%, and yes, anterior chest is 9%, and posterior chest is 9%. Means if in examiner the given the option like complete thoracic cavity is burned, means 9% anteriorly, 9% posteriorly, means 18% of the thoracic body surface area is burned here. Okay, okay, and examiner given that is the yes complete anterior portion from the thorax to the uh, genitalia. Okay, from the thorax to the genitalia. Okay, so how much percentage of the body surface area is burned? I told that is the only anterior surface. Means yes, the anterior thorax is 9%, anterior abdomen is 9%, and thorax is the 1%. Okay, so that is the 9 plus 9, 18, 18 plus 1, that is the 19% of the area get burned here. Okay, like this the question will comes here. Okay, very simply let me us distribute the like 9% rule here. Okay, that you can understand forever. Okay, head and neck for adult, it is the anterior plus posterior both including the 9% only. Okay, both anterior both anterior and posterior including 9% only for head and neck. Okay, and for anterior chest it's 9, posterior chest it's 9. Okay, for anterior abdomen it's 9, posterior abdomen it is 9%. Okay, and genital is considered only 1%. And when it comes for the hand, okay, anterior hand is 4.5%, posterior hand is 4.5%. Okay, that is again one complete hand, that is yes 9%. Okay, and when will come for the our leg, okay, one anterior leg is 9%, posterior leg is 9%. Okay, so one complete leg burn means that is 18%. Okay, only leg burned anteriorly completely means that is 9%. Okay, only leg which is burned from genitalia to the knee, okay, only anteriorly means that is the 4.5%. Is that clear? Clear. Okay, yes, only half of the leg burn, okay, only anteriorly, and it is half of the leg burn, that is the half of the 9%, that is the 4.5%. Okay, and yes, the complete anterior leg is burned means that is the 9%, including anterior posterior both leg is burned means that is the 9%. Okay, so clear? Right leg, left leg same. Okay, so this 9% plus this 9 9 9 9 9 9. Okay, this all 9 including that is the 99 plus 1% total body surface area which will be calculatable is the 100%. Okay, how the concept is clear? Yes, so the question this one is that clear? You have to practice this twice and thrice by drawing the image so you can understand better. Okay, yes, here's the next question. Very simple question. What is the pedophilia stands here? What is the pedophilia stands here? Option A is child sexual abuse. Option B physical abuse. Option C verbal abuse. Option D mental abuse. I am waiting for your answer, students. Very simple question. Just give the answer fatafat. Yes, very nice. Very nice of you. That is the child sexual abuse. Pedophilia. That is the pedia is the child and philia is the yes a sexual preferences where the a person prefer the opposite object to get the sexual satisfaction. Okay, if consider this person, okay, so this person is considering the one animal, okay, one animal for the opposite sexual partner, okay, for his sexual satisfaction. So along with animal the person is considering his satisfaction in the sex. So that is what we call as in the zoophilia. Okay, zoophilia. Then, if the person is considers the opposite sexual partner as a child, so that is what we call as the pedophilia. Okay, what is what that one we call as in the pedophilia. Okay, so hope the concept is clear, and many sexual preferences diseases are there. We'll discuss when we'll discuss the in the psychiatric. Okay, so option answer for this question is the our child sexual abuse. Okay, remember one more question, that is the animal. Okay, man prefers the sexual partner as an animal for his satisfaction, so that is what we call as in the zoophilia, and man prefers the child for his for his sexual satisfaction, that is what we call as the pedophilia. Hope the concept is clear, and here is the next question for you. Yes, read the question carefully, then give the correct and best option answer for this one. Yes, the normal human body temperature is maintained by option A, fat. Okay, so you can write this one as in the brown fat for your easy understanding purpose. Okay, option B, carbohydrate. Option C, fiber. Option D, protein. Students, in some consent, all four are responsible for the maintenance of the temperature, but major constituent which is maintained by the fat, that is especially brown fat in the children's. Okay, so this is pediatric question, and the question like it is having the not a proper stand here. So like in RRB they have asked for the question like this only. So the answer they have considered it is as the fat only. So we call this one as the yes, that is the brown fat which is responsible for the yes maintaining the body temperature. Okay, hope the concept is clear. Yes, yes. Here is the next question. Simple question. Okay, the surgical removal of the entire content of the orbit is known as, and including the eyeball, eyelid, everything they are removing, means this is the our beautiful face. On the face we are having the two eye socket. Okay, so on the eye sockets there is a fat, and on the in the like fatty area extraocular muscles also there, here it is attached, and in the fatty area yes eyeball is there. So the surgical process which is removing the eyeball, which is removing the extraocular muscles, which is removing the fatty content, which is removing the yes eyelid also. So what with this surgery, the entire content of the eyelid, the entire content of the eyelid is removed. So what we call this one as in the yes, this one what we call as in the extensoration. Okay, what we call this one as in the extensoration. So already I have discussed in detail these questions in the ophthalmology session in my video lectures. Okay, so during the NORCET preparation time, so do watch the video on the eye disorder. Okay, fixed question classes. Yes, that is the extensoration is the surgical procedure which removes entire orbit content plus yes, that is the eyeball, eyelid, everything. Okay, what if examiner is asking the question? Okay, only yes the internal content of the eye is removed. Okay, but sclera is intact and extraocular muscles are intact. Okay, sclera, extraocular muscles are completely intact, and only the internal content of the eye is removed, means that is what we call the evisceration. Evisceration is the yes and content of the eye is removed, but the sclera and extraocular muscles are intact, means they have not removed these two. Okay, okay, sclera and extraocular muscles are intact, means there is the evisceration, and yes only extraocular muscles is intact, and they have removed everything, that is eyelid they have removed. Okay, then sorry, eyelid not eyelid, eyeball they have removed. Okay, all three layers like internal layer, middle layer, and outer layer, retina, choroid, and sclera, all these three layers they have removed. Okay, and extraocular muscles they have kept intact, so only extraocular muscle is there. Okay, so along with this eyelids also present. Okay, so extraocular muscles plus eyelids they have kept, plus eyelids they kept intact. Okay, then they have removed everything, that is what we call as the enucleation. Hope the concept is clear. Okay, you have to search for the content. Okay, but which one is intact there, so that will give the correct answer. Okay, hope the concept is clear. Evisceration is the yes removal of the eye content, but the sclera and extraocular muscles are intact. Okay, and enucleation is the removal of the eye content where the extraocular muscles and eyelid is intact, and including the eyelid, extraocular muscle, entire orbit content they have removed means that is what we called as the extension. Okay, hope the concept is clear, and answer for this question is the option C, that is extension. Hope the concept is clear for this one. Yes, few of you have given the correct answer also. Very nice of you. Okay, keep moving. No one can stop your study. Okay, so no one can stop your preparation. One day, one fine day, the result will come. The rank will come. Okay, you also become a nursing officer. You also wearing a uniform of the aims. Okay, so you also having the 80,000 plus salaries in the bank account, and a very good smile on the face of your parents. So that is what we are struggling all together here, students. Okay, so if you are getting bored during the study, don't quit the study. Okay, get the relax for a 2 minutes, 3 minutes. Okay, listen one good song. Okay, listen some devotional song. Okay, refresh your mind. Okay, sit again on the video lecture, sit again on the notes, sit again on the books. Okay, not on the books, in front of the books. Okay, so that will gives a perfect satisfaction while sleeping on that day, particular day. Okay, so each and every day you are doing the successful task means, so that will give us the result as a brand. Okay, so hope the concept of this question is clear and motivation helps you all. Okay, so yes, so we'll finish this today's class here. Okay, in the tomorrow's class we'll again discuss the very important topics. Okay, and the what are the concept I am teaching in the each and every question, so that may helps you all in the upcoming RRB and NORCET exam, and that helps you all for becoming a nursing officer in the central government institutes. So that is what a teacher really want from his heart. Okay, so if you are new to my channel, so don't forget to subscribe to the channel. Okay, so and I'm posting some important questions also in my Instagram, in my Telegram handles. Okay, so the link is there in the description box, so you all can join my Telegram group also. Okay, so link is given in the description box. Okay, my Telegram group name is also as a Master Nursing Classes. Already like 750 around members are there in my group. Okay, so do join the group and solve the daily questions, and you will get the some important updates in the our nursing field. What the aims is repeatedly asking, that important updates will timely give in that particular Telegram group. Okay, so we'll meet again in the tomorrow's class. Okay, so revise the content whatever you have written today, and so summarize the today's class. Okay, so we'll meet again in the tomorrow's class. Tab tak ke liye, Jai Hind, Jai Bharat.